Thanks. Oh, no, I want a little bit of noise. Come on, you guys. At the Misericordia Hospital, it's not just sewage leaks and gas lines, faulty gas lines. On average, twice a day, staff are forced into crisis overcapacity management. Documents Alberta New Democrats released today showed the MIS is running overcapacity almost 600 times in the last 14 months. Almost every day, this hospital is either out of space, understaffed, or both. To the Minister of Health, Edmontonians find this situation completely unacceptable. Why don't you do something about it?
The Honourable Minister of Health.
Well, Mr. Speaker, we are and have been working with Covenant Health for some time to address the issues at the Misericordia. I can't count the number of times now I've been asked and answered these questions in the House. Mr. Speaker, a $19.2 million commitment to critical infrastructure repair at the Misericordia is a major commitment, knowing, of course, that there is a limit to the remaining useful life of this facility. It is one of the oldest facilities in the province. It is also in one of the highest demand areas of the province. So, Mr. Speaker, we will continue to invest the dollars that are necessary to keep things operational at the Misericordia.
For a supplemental.
Well, given that overcapacity means 5 patients in a room, overcapacity means not all the essential equipment is available that patients need. Overcapacity means that many more patients for the same amount of staff. Can this minister then explain why, yet again, funding to start building a new Misericordia hospital is missing from this year's budget?
Honourable Minister of Health.
Well, Mr. Speaker, one thing I want to make very clear, and I certainly acknowledge the infrastructure issues at the Misericordia, and I have thanked the staff in the past, and I will thank them again for their ability to cope with those particular challenges. But, Mr. Speaker, at no time is the quality of care that is delivered at the Misericordia Hospital been in question. It is not in question today. It was not in question a year ago. It was not in question 10 years ago. So, Mr. Speaker, we see demands at the Misericordia that we see at other major hospitals across the province. The short-term issues have been addressed by a $19 million commitment. The bigger issues of new hospital capacity for Edmonton.
Final supplemental.
Well, given, Mr. Speaker, that overcapacity is chronic at the Misericordia Hospital, and this government has put in no plan to build that capacity, can you really blame Edmontonians for suspecting that this PC government has no intention to build a new West End full-service active treatment hospital now or in the foreseeable future?
Honourable Minister of Health.
Mr. Speaker, the plans that we have underway are the same plans that I've described in answers to previous questions. We are looking at infrastructure hospital needs for Edmonton and for the capital region today. Mr. Speaker, the issues around infrastructure at the Misericordia are serious issues. They are short-term issues. The longer-term planning is well underway, as I said, for the Edmonton zone. We will be looking at opportunities across the capital region that we need to capitalize on. In the short term, our commitment to the Misericordia stands.